All right. So then I'm going to take it to, I'm going to show you a different calculation. Because we have here not only practices who do PT, but practices who incorporate also diagnostic testing like EMG and musculoskeletal ultrasound. Let's see how the numbers are for them. I'm going to use exactly the same numbers, 84,000, 144,000, 240,000 that we need for financial freedom. At an average reimbursement of $250 per test, which is pretty average. And here I'm utilizing, when I'm saying a test, it can be a combination. It can be an ultrasound, it can be an EMG, it can be an evoked potential study. I'm using a very conservative number, $250 per test. At a 35 to 40% profit margin that you can run easily that business, that will give you $100 profit for every test that you do. For financial freedom, you're going to need 24,000 tests in 10 years, or 200 tests per month, or 25 tests per week. And you're going to need half a physical therapist to produce this for you. That assumes that the physical therapist can do 50 tests per week. That is 10 tests a day. That includes a musculoskeletal ultrasound that takes you 10 minutes to do, and it includes an EMG that can take you 45 minutes to do. Okay, so I'm very conservative here. So most practices, they'll have a combination of diagnostics and physical therapy. So a combination of the two can provide you really with what you're looking at. But the key, guys, is how do you get this profit margin? If you only did physical therapy, then you get the 20% profit margin. And when I'm talking about 20% profit margin, I'm talking about you paying yourself before you calculate the profit margin, paying yourself at a rate as a physical therapist, paying yourself at the rate as a manager or whatever other work you do. So it can be pretty challenging, especially when you see this statistic here that nationwide practices are making on the average about 8%. So getting to that level of 20%, it's going to be challenging. So one way to do this, and why you're not getting enough, is it because you don't have enough production, or you do not have high reimbursable production? So you see, if you have hundreds of patients that their insurance pay you $50 a session, you will never make it, because it will cost you so much more to deliver service. So I'm borrowing here Mike Michalovic's concept of the pumpkins, okay? Pumpkin plant theory. That's the small pumpkins and the big pumpkins. If you have only small pumpkins and you put your attention only in the small pumpkins for your revenue, if you're putting all of your attention, all of your effort to deliver your services for the $50 a visit insurances, then you won't get to the 20% to the 30% profit margin. In order for you to increase your profit margin, you have to put your effort and your focus on the big pumpkins, those insurances that they pay more. How can you direct your marketing efforts towards those insurances that pay more? And Furthermore, I'm saying that at least my experience, when you concentrate here only on PT, these are your small and medium-sized pumpkins. In our practice, we also do diagnostic testing, nerve testing, musculoskeletal ultrasound, which they deliver much greater revenue per visit. And therefore, we are able to have bigger pumpkins and greater percentage of profitability.